Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. Welcome back to The Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion. But before we jump into our topic for today, I want to tell you a story. Paul is a 50-year-old Middle Eastern man who runs a thriving family business. For several weeks, he had been having chest pain while walking up the stairs. His wife, being concerned, made a doctor's appointment for him. After his GP saw him and arranged some blood tests and started him on some medication, his doctor arranged further investigations and an appointment with a heart and lung specialist. After these appointments, Paul was told all was well. However, a few months later, Paul suffered a heart attack and started a slow journey towards recovery. His wife was shocked as she knows that Paul's doctors did several scans, several blood tests in all the months prior, but Paul still had a heart attack. Paul was treated and had something called a stent put into his chest. A few months later, Paul's wife asked the doctor why the tests initially said that he was fine, but he ended up having a heart attack anyway. The doctor explained the limitations of current technologies and tests in picking up disease. Paul's wife now wants to know if there is something she could have done earlier. She wants to help others who may not be as fortunate as her in having their spouse be well after a heart attack. As you may have seen in the past week, artificial intelligence has been picking up in scans warning signs of future heart attacks that we had previously assumed was normal. These previous scans have now been classified as having high risk of eventually developing a heart attack. And this reminds us that medicine is not an exact science, but instead relies heavily on technology and research to provide solutions. What does this mean for people like Paul and his wife? What does this mean for people who may not even have warning signs like Paul did? The first thing is to realize, as I often say, that when your body is acting out of the normal, it is telling you that something is wrong. So what are the signs of a heart attack? But also, what are the things that we can do intentionally in our homes and in our lives to help us reduce and minimize the risk of having heart disease? So what exactly is heart disease? Heart disease is a word that we use to describe several conditions that affect the heart and the blood vessels. The most common type of heart disease is what we call coronary artery disease. And that happens when the blood vessels that supply blood to the heart become blocked, or sometimes they can become narrowed. They can become blocked because of deposits of fatty tissue that have developed because of high cholesterol, or sometimes they can become blocked as well because of blood clots. Now, although there are different kinds of heart disease, we normally classify the risks into things that we can change and things that we cannot change. Things that we can change include blood pressure being elevated, high levels of cholesterol, diabetes risk factors, especially type 2 diabetes, smoking, BMI, that refers to our weight and our height, and lack of physical activity. However, the things that we cannot change are things like our age, our gender, and the presence of heart disease already in our family. Now, like Paul, he was already experiencing symptoms when he was walking up the stairs. And yes, chest pain is one of the most common signs of heart disease, but other signs of heart disease can be shortness of breath, increasing levels of exhaustion and tiredness, a sensation that your heart is beating a lot faster or skipping a beat or being a bit more irregular than it usually would be. Other signs can be dizziness, swelling in the legs, or also a pain in the neck and the jaw. In situations where someone has severe chest pain and they have pain in the jaw or in the left arm, we would normally recommend calling an ambulance and visiting the emergency room immediately. So what can we do to minimize our risk of having heart disease? What can we recommend to our family members, our friends, parents, uncles and aunties? We can recommend that they get some exercise. Something as simple as increasing the number of steps they take on a daily basis can significantly have an impact on their heart health. That might mean encouraging them to go on a simple 30-minute walk every day after dinner around the local neighborhood. That might mean, as a couple, making a plan to run a 5K once a month in your local park run in the local park or village. That might also mean making simple swaps in the house, encouraging one another to eat whole foods as opposed to highly processed foods as well. The most important thing when it comes to our health, especially our heart health, is being intentional about what we put into our body and how we use our body. Making sure that we're eating well, making sure that we're avoiding things like smoking and things like tobacco, making sure that we're moving our body. But something that we sometimes do not talk about enough is managing stress. Things that can help us manage stress are deep breathing, meditation, prayer, sleeping well, having a good network of friends and family, having someone to talk to, an outlet such as therapy, or a good friend or partner that has the skill of listening. And something else that is extremely important is having a hobby that you truly enjoy. So what could Paul have done differently? Well, in Paul's situation, we don't know what other risk factors existed. And Paul did have his doctor have the investigations. So in Paul's situation, the technology was just way behind him in terms of the presentation of symptoms. But what Paul and his wife did that was good was that they sought help once they noticed that there was a problem. So I want to remind you today that if you notice that something is wrong, make sure you seek help. But also, as you go into this week, while it is still summer, the weather is still good, encourage yourself to go for that 30-minute walk after your evening meal. Let's get those steps in and make it count towards your heart health. Until I see you again tomorrow, back in your ear, with stories that heal and knowledge that empowers. Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.